Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hello, Vet Tales.
Hello.
Dr. Natalie Keith.
Dr. Josiah Dame.
And today is part 2 of blood work.
Yes.
We're doing chemistry today instead of the CBC we did last time, complete blood count.
So we did a little bit of clotting.
Yeah. And that's talking about like our whole cells. And these are going to be like enzymes and electrolytes and markers and
proteins.
Indeed. So we're going to go through, basically we just have literally a list of the things that we see in many of our common blood panels, why we're looking at them, what they mean, do we care, when do we care, what do we do when we care, and so forth.
Mm-hmm. And when do we do lab work?
Typically, anytime I can.
Yeah. It gives a great window into the body, allowing us, because we can't ask them, like, what are you feeling currently?
Well, I mean, and even if you could, like, they would just be like, they'd be like, thirsty. I feel thirsty. And you're like, great. So is that your kidney or is that your diabetes? Or like, do you have diabetes insipidus? What's going on?
Exactly. And so, yeah, lab work is great just on a wellness side of things too, yearly, depending on when patients are geriatric. But then obviously we commonly do it when pets are sick. So vomiting, diarrhea, PPD, which means drinking and peeing more often.
Inappetence, chronic diarrhea, or waxing and waning diarrhea, like all the Addison's talks that we had not too long ago. That kind of, I don't know, just all sorts of different...
Weight loss,
yeah.
Classic things.
Yeah. Basically, if you have a pet that isn't well, blood work is a good idea.
Mm-hmm.
And then also, like, we like to do them at 7+ screenings to... get a head start on these things. If we're running blood work annually and you notice that kidney value was like low last year, and then it's like middle ground the next year, you start going, and then you might check it a little sooner and go, yeah, that's still climbing. This dog's normal is elevating because it's a range. So one dog's normal might be 15 and all of a sudden it's 29. Well, that's still normal, or 24, let's say. And that's still normal, but it's not that dog's normal.
Yep.
And so now you're seeing this uptrend and you go, okay, we need to start watching this way closer, because you can make easy modifications early that aren't going to cut the mustard later if you're catching this dog when it's in full-blown renal failure.
You can also have dogs who have slightly higher values, like as normal. So my personal dog comes to mind, Hannah, who has always, since a puppy, ran slightly high on BUN and it freaked me out when I was assistant. I was like, excuse me?
Yeah.
And y'all, I'm like, it's fine. But now you know what her more normal is. And then through the years, yes, it's just slightly above normal on the range. And that's her.
Yeah.
She says.
Well, and they have that DNA test that they
if we get the marker, the ALT one.
Yeah, and then basically what the DNA says is they have a gene that is going to make this dog's ALT look low all the time. And that is normal for this patient because of the way its genetic makeup is. And so those healthy early blood tests help us understand normals. And so anyway, yes. So those are times. We're screening before pre-anesthetics, when your dog is sick, that kind of thing. So I think you want us to just start with A?
Yeah, we'll start with A. These are these in alphabetical? I was like, why did they pick this order? The alphabet.
The alphabet is what, as opposed to organ system.
Yeah. All right. So A, albumin.
I love albumin. It's one of my favorites. It's a protein.
It's the bigger protein.
It is. And its main job is to keep oncotic pressure normalized. So basically think about, this is the way I explain it to clients, like strawberries. If you put sugar on them, all of the water leaves the strawberry and goes to the sugar. And then you have syrup. It's great. So basically the albumin is acting as the sugar, if you will, and the liquid wants to stay with it. So if you have enough albumin in your bloodstream, the liquid stays in your bloodstream. And if you do not have enough albumin, then it leaks out into your body cavities or tissue, and that is bad.
We call that hypoproteinemia.
We do. And then it causes edema, ascites, or effusion.
Yep. And it's not fun. But we'll look at that albumin on the lab, and it's made by the liver.
Yeah.
So in end stage liver disease, you can have a decrease of that too. We commonly evaluate it for hydration status, hemorrhage. So if you have a really low one and you have an acute hemorrhage, that could be why. Might could be not.
Might could be not.
And then hydration. So it'll be high in a dehydrated dog.
Yeah. And then if it's low, you have to say, okay, well, are we leaking it, losing it in the intestines or the kidneys, or are we just like flat not making it? That's less common. Usually it's leaking out through the gut or the kidney. And so then you go hunting for problems. So
not very common, but that's the reason why it's
Yeah.
Next one is ALP or alkaline
Alphos.
phosphatase.
Yeah. Or we call it alphos. Yeah.
Alphos, yeah.
Alkaline phosphatase.
Typically elevated due to hepatopathies, liver damage, liver-related things.
Yeah.
The most common reason we see it in older dogs is going to probably be Cushing's disease. So Cushing's disease, which we've talked about before, go back and listen to that podcast. That's where your body's making too much cortisol and your ALP will just skyrocket. So these dogs are like 700 plus. Yeah. Commonly like 1200, I feel like. And then they got the typical Cushing's appearance. So when I see that, I see the dog on exam, I go, great, let's go investigate Cushing's disease. When do we see an elevation that we don't get worried about though?
When they're already on like phenobarbital, is that what we're talking about? Or or pred, Yeah,
they can have medically induced elevation ALP that we may not be concerned about because it should resolve. And that's because of the secondary hepatopathies that can occur.
Yeah, because the liver's just working harder. And so you kind of expect that as a secondary finding when these dogs have to be on these medications. And you just go,
okay. Like when you have immune-mediated hemolytic anemia dogs and you're on such high dose of steroids and you recheck their lab work 30 days later and you're like, that ALP is super high, but I know why. It's because I've had you on pred and we're going to get off of it soon.
And
then puppies and growing animals because ALP with bone growth.
Because it's phos, which is like phosphorus. And the phosphorus because that's another separate thing, which we'll go over later, but it also will be high normally. Yeah.
And so basically you're going to be doing your pre-labs on your puppies and you might be like, oh, there's an ALP elevation. Oh, we're a puppy. We're growing.
The bone growth causes the phosphorus levels and the alphos levels to be high.
Yep. All right. And then the next one, and I'll let you do a couple.
All right.
Alanine aminotransferase, or ALT, which is also a liver value. That's the one we care most about. Commonly, people would hear me say, I care about ALT. That indicates liver damage. So those hepatocytes, those liver cells they're getting destroyed.
Yeah, and their little bitty contents are going all over the place, and the body's having to take it up in the bloodstream.
Yep, and that could be caused by so many things.
Yeah, hepatitis, which could be like autoimmune. It could be infectious. It could be like a secondary
storage disease, which is just
copper. Stuff like that. Maybe hepatic lipidosis in a cat. Yeah,
trauma.
So
dogs who get kicked in the belly by horses,
or hit by cars.
Hit by cars. I'm like, recently I'm thinking of the one that got kicked by a horse, and that will cause an ALT elevation. Any toxins, a lot of toxins that affect the liver will cause an ALT elevation. Yeah. So that's super, super common.
Like if they get into the bottle of aspirin or ibuprofen, definitely. Yeah, I've seen it with some mushroom ingestion,
I've seen that too.
Like they're like naturally growing ones in the backyard. Yeah.
And then with ALT, there is definitely a range there too, where the normal range, I think, is about 120-ish in dogs, 118, 120. But technically, it's not a significant elevation until you're 3 times up the reference interval, so closer to 300s.
Yeah, so if I see one 150 or 170, I go, meow.
Meow. Yeah.
Don't care.
That's fine.
I'll keep an eye on it.
Yeah, that's usually what I tell people. I'm like, let's keep an eye on it. If you want to be aggressive, we can do some ultrasound, some looking, some peeking, because, obviously, if it's a 12-year-old dog with a mild elevation, I'm like, let's just make sure there's not a tumor in the liver.
Yeah.
But
although, I've seen dogs with wicked liver tumors and not one single abnormality on the blood work. It's just amazing.
That's because you only really need
so much, like 15% or something. Yeah, I don't know.
25 or 15% before your liver starts to really
struggle with function, which is wild to me.
Crazy. And then kidneys at 66th birthday.
And when you start to see, when you start to see some changes, but you really don't struggle until you're down below 30.
Our bodies
compensate.
Are amazing.
I mean, honestly, there's so much wiggle room.
It's crazy.
Oh, my turn. I get to hold the paper. All right. It's very exciting. Oh, BUN. I do love BUN.
Mm-hmm.
And we may go out of alphabetical order on this one just to hit the kidney stuff. So blood, urea, nitrogen. It's one of our favorite things to look at of the three. There's three of them that we really look at when we're talking about kidney disease. It will be high. Low BUN isn't really a thing that I can think of. Maybe.
I've seen it on.
Yeah. And I'm not sure to do with that.
Typically the GGT as well.
Yeah. Okay. So anyway, when we have these elevations, it's technically called azotemia, where we have elevated renal enzymes. It can be kidney related, or it can be pre-kidney or pre-renal, meaning the dog was just really dehydrated, or the cat. So the way we distinguish the difference is by checking urine specific gravity. And if the urine is really concentrated, then it could just be dehydrated. And if you rehydrate them, then the body flushes out all those extra toxins, because these are breakdown products that should not be in excess in the body. And so if they are building up in excess, it's either because it's too concentrated because your blood is concentrated, or because your kidney isn't getting rid of them like it's supposed to.
Yes.
So you could also have post-renal azotemia, which is most common in cats when they are obstructed, or any animal with a urinary obstruction, but it's just really common in cats. And their little BUN will skyrocket.
And sometimes they have concentrated urine, and sometimes they don't. It just depends.
And and it really doesn't.
You just gotta go off of them.
Yeah. And then you unblock them and you give them fluids, and 90% of them are fine in terms of their renal values within 3 days.
Yeah. If not 12 hours.
I mean, it's not, really quickly, depending on how long they've been blocked and how much true trauma there was to the kidney. So I'm going to go to alphabetical order and just go ahead with the creatinine is the other one. Creatinine is a little bit less finicky. BUN can go up and down. It'll change wildly by 20 or 30 points in a day, and can be much more sensitive to things like diet changes, like GI bleeds, increased protein in the diet, dehydration. Creatinine's more even keel. If it's elevated, you should be more concerned. I mean, you can still get elevated creatinine with just dehydration, but it's just not as...
We could blame that one more on the kidney than the BUN.
Absolutely.
It can have a little bit more influence from other things.
Yeah, absolutely. And then phosphorus is the third one we look at. It can also go up with like hyperthyroidism, bleeding disorders. I don't really know much about that, but that's what the paper actually says here. I guess because you're digesting the blood product.
Yeah, and then panting can cause a falsely elevated phosphorus too, I believe.
Interesting.
It does change the phosphorus, like excessive panting.
I think I vaguely recall that when we used to have those.
It has to do with blood gas.
Yes.
And acidosis and things like that. So I believe it causes an increase. I know that y'all probably don't care.
Yeah, you maybe don't care. If you do care, fact check us and let us know, because we're just going off of memory up here and this alphabetized list. Okay, I'll do one more and then I'll hand it back to you. Calcium. Tell me what you think of.
Cancer. If it's above 13, I immediately think cancer.
Yeah.
Mild elevation, I'm like, is our machine wrong?
Right?
We've talked about on this podcast that calcium is finicky, but slight elevations can be kidney related. Really high elevations, like I said, 13 is when my alarm bells start to go off. That's when I'm like, ooh, cancer. And there's two types of cancer that I think of. I think of lymphoma, and I think of Hagasaka, or anal gland
adenocarcinoma. Yeah.
But in school, we call it Agasaka.
Wait, we did not. So every time he says that, I'm like, I'm sorry, what? Is this a Japanese alcohol?
Sake.
Yeah, sake. No, it's we just called them adenocarcinomas. So Agasaka.
I think Richie taught me that.
I mean, he might have. I don't know. Maybe I ignored it. I was just like, no, I'm not saying that. I'm not saying Agasaka. Anal gland carcinomas are number one that you're thinking of. And then also you can have hyperparathyroidism is the other reason. But then you got to get your ionized calcium, and it's a whole nother can of worms.
Yes. Which, if you have elevated calcium, there's a malignancy/ionized calcium panel that can help you differentiate between cancers and the parathyroid disease. And I've had a couple parathyroid disease dogs in Dallas when I worked there.
Yeah. I've had one, and that's been probably 6 years ago. It was, we did not do surgery on her. We just managed her with prednisone, because that does help tremendously. Anyway, okay, so calcium, tumors, hyperparathyroidism. You can see changes with kidney disease as well. especially in cats. Okay, your turn.
All right. So back to amylase.
Oh, did I skip one? Oops. I did.
Okay, so it's fine.
I started on BUN.
It's
oh my gosh, you guys, the alphabet.
Amylase is something that we don't evaluate, I feel like, too often. Like if it's elevated and the animal is clinically normal, I will not really care. But if they're vomiting and they have GI pain, like when I'm pushed on their belly, and I look at the lipase, which is also on our 10 panel, and both are elevated, I immediately get concerned about pancreatitis.
Absolutely.
So those are my go-tos for that. Amylase can be elevated in kidney disease because it is also cleaned out by the kidneys. And I have seen dogs and cats with elevated amylases that are in chronic, terrible kidney disease. Currently an patient who has a really high amylase because of kidney disease, not because of pancreatitis. So yeah, when I have a vomiting dog, and I'm worried about pancreatitis, I look at lipase, I look at amylase, and I look at ALP because when vomiting dogs, you can get mild elevations of ALT. And you get
well, if the pancreas is mad, it makes everybody around it mad, including the liver. Yeah, everybody. But specifically the duodenum and the liver. And so your liver values will go up on those guys. The leakage enzymes will.
Yeah. Fancy word, triaditis.
Oh, I love triaditis. It's such a great word. Yeah. It's fun to say.
It is.
Not great for your patient.
No, but they
get over it.
They get over it.
Yeah. You just treat them. They get over it. Pancreatitis, reference that. Yeah. Reference that podcast.
Some other like GI related values that we look at are going to be lipase, amylase. With the cholesterol, we'll look at triglycerides and cholesterol sometimes, which will play into some of our liver disease dogs, GI dogs. Hypothyroid dogs can have elevated cholesterol. Cushing's disease will commonly have cholesterol
They
issues.
Definitely do.
Diabetes will commonly have cholesterol issues. And then we'll circle to...
Not that we really treat cholesterol issues in dogs directly. You manage the secondary condition or the primary condition, and usually cholesterol gets better, but we don't have issues in dogs with plaque. What is it? I'm not a human doctor. When you're in your vessels.
Coronary artery plaques.
Right. Yeah, something, and there's like some other word. Someone with heart problems in their family is like screaming at us right now as I listen to this.
Gorillas.
Anyway, yeah, they definitely, whatever it is that builds up in our veins because of high cholesterol does not happen in dogs. The biggest issue is it makes it really hard for our blood machines to breathe the blood work.
What's the breed that...
Schnauzer.
Yes, Schnauzer. So Schnauzers can have a primary hypercholesterol, hypertriglyceridemia, which sometimes you need to treat depending on if they have like chronic GI signs and they're negative for their thyroid stuff.
And they got pancreatitis every 5 seconds.
Every 5 seconds. You may do a low-fat diet, which you're already going to do because of the pancreatitis. So sometimes, and then there is a medication that you can put them on to how to do once. Most of the time they respond well to a low-fat diet. Yeah. But okay, wow.
Look at us go. We're just cruising. Yeah.
Let's go to electrolytes.
Oh, gosh.
Yeah.
Oh, God. That's perfect. I like potassium. Potassium I find to be quite helpful.
All right. So electrolytes, we're looking at sodium. We're looking at chloride. We're looking at potassium. And those three.
Yeah.
Am I missing one?
You are, but I can't think what it is.
Sodium.
No, you already said that. Oh, potassium, sodium, chloride, potassium, and do they count calcium? That's what's in our light panel.
No, it's calcium.
Yeah, isn't it?
No.
That's not right? No. Oh my gosh. Okay, you keep talking. I'll Google it.
Talking. So wildly important, sodium and potassium. I look at them every single day and go, does this patient have this?
Every day.
Every day.
Or are they obstructed?
So like
it is. No, you're right. This is so dumb. It's called because it's called light foreclip, but it's just sodium, potassium, and chloride. Yeah. Why is it not the light
they flip? One of them is the ionized version or something.
Okay.
Then, I'll give you the complete value.
That's just
So the two values that I look at most importantly are sodium and potassium. For block cats, I'm definitely looking at potassium because if it's elevated, a high potassium is typically because you have a blocked urinary tract. Mm-hmm. So that is going to be our block pumps and everything like that. If you tend to unblock them, they tend to resolve really rapidly. Of course, you may have to have some intervention if things are really out of whack, but medical intervention to like lower the potassium. Very commonly, though, you just have to unblock them.
Yeah, and the body will fix it.
Yes, and same with sodium. So sodium, I'm sorry, sodium.
With sodium chloride, yeah.
With sodium, we tend to look at that when we're trying to diagnose Addison's because there's a sodium-potassium ratio that's really out of whack. But with sodium, if you have like a dog that's at the beach, so we don't see this very often, but if you have a dog that's like at the beach and it's feeding or drinking the water constantly at the beach and then it gets sodium toxicity.
Well, the other thing is like salt rocks in the winter.
Yep.
But anyway,
that
go
too.
ahead. Yeah.
It really, you have to correct that, but depending on how quickly they got the salt toxicity or how quickly the sodium got to where it is, you have to like
titrate it down. It's terrifying.
It's really scary because they get brain swelling essentially. Yeah. And so if it changed quickly, you can fix it quickly. If it changed slowly, you have to fix it slowly and vice versa. So it's tough.
Yeah. My other most terrifying is when we have the DKAs and you're trying to fix it. You're trying to fix the diabetes issue and your potassium's just tanking on you. Yep. And you're like, having to add in potassium chloride and you're like having heart palpitations of your own because it's so scary, but you have to do it.
I think they just scared us in school.
Yeah,
but yes, DKAs are common where you end up, because you're giving so much insulin, you end up taking the potassium, so then you have to supplement the potassium in the bag of fluids. And potassium chloride, when given,
it gives you a heart attack.
It could
literally.
It will give you a heart attack.
Definitely will.
We, do all of our calculations and I
double check it.
All the technicians, I'm like, label that bag like crazy so that
we mix the bag thoroughly. Yes.
There's a paper that says mix the bag up and down 7 times, and that's completely mixed. And that's why I looked at the technicians and I'm like, 7 times.
And then an extra one for good measure.
Yeah, and then just a bunch more.
And then some more.
So that it doesn't pull at one spot and then go all in. So that's the electrolytes. And then really, we have just gone through this.
Which is great because we're at like 23 minutes, which is our norm.
Beautiful. The other ones, and I'll leave the last one for you, but the other ones that I wanted to bring up, albumin was a protein that we talked about. And then we have globulins on our panel, which is another protein. This will elevate due to certain disease states. So one that comes to mind is tick-borne illnesses will cause a really high globulin count. Chronic diseases will cause it. Cancer. Cat cancer. I feel
they loved it.
Yeah. And I'm stuck. I'm really worried about cancer. And then you can actually get
the monoclonal.
Yes, you can get a group of globulins that are all the same origin. And so you have to do a test called protein analysis, electrophoresis, and they find out, all of these globulins are exactly the same.
Yeah, it's one little globulin guy just going nuts.
And that's cancer.
And
then if it's a bunch of different ones, then you're like,
chronic inflammation.
So that's something we look at, but can also be elevated in dehydration. Also decrease in hemorrhage. And then total protein, bam, you're just looking at
albumin plus globulin. Yeah. And if it's high, then you need to, like, if you just run a total protein and it's high, then that's when you've really got to go back and sort out albumin from globulin because that tells you
the story.
Yeah. Okay.
Glucose. I think that's
glucose. How exciting for me. So funny today. I know. Glucose. Boy, we could write a book on this. I had one today. This is kind of random, but this little dachshund came in because she had some mammary tumors and had some bad teeth. And the owner was worried because it was a new patient to us. And she was like, my other vet had said these were probably cancer. And I'm just getting really worried because now she's losing weight and drinking and peeing all the time. And I was like, so we ran some blood work. And guess what? She's diabetic.
Yeah.
Her glucose was like 400. Yeah. Anyway, so she has bad teeth, mammary cancer, and now diabetes. Yeah. God love her. She's happy as a clam. But glucose, so it has, obviously the high and the low side of things. If we have hypoglycemia, we can think about several things. One would be like little puppies. That just cannot manage their blood sugar yet because their liver and their fat metabolism just aren't at capacity yet, especially small breeds.
Kittens.
Yeah, little kittens.
Who have fleas.
Yep. So that's why it's so important in little kittens and especially small breed puppies to have access to food at least every 4 hours during the day and every 6 hours at night so their blood sugar doesn't drop. If they do drop, they'll get really lethargic and you can give them like honey or sugar to spike them back up.
Yep.
So there's that. Other reasons for hypoglycemia. One of them is, sorry, my phone was ringing and totally pulled me off track.
Insulinomas.
I hate those.
Which I've had a couple.
Yep. So the pancreas will just crank out insulin all of a sudden.
Tumors.
Yeah.
We did talk on it.
We did do a talk on insulin. Yeah. And then we have also ingestion of fake sugars. Xylitol specifically will cause the dog's body to think it's sugar, but it isn't. So it kicks out insulin, drops all the blood sugar down. If there's not any sugar, it's a problem. And then we actually can see that in Addison's disease. Woo! That one burned me once. Dang it. Hate Addison's. Anyway, so that's the low blood sugar spiel. A high blood sugar is basically either you just recently ate a whole lot of sugar and it's transient.
Mm-hmm.
Cats will get a transient stress hyperglycemia. So they come to the vet clinic and their blood sugar just skyrockets to 250. And you're like, is it diabetic? I don't know. Wait 30 minutes to 4 days and it'll be normal again. And so you just watch those guys. And then you can also have a really acute stress event, like a dog that goes into cardiac arrest for some reason, their blood sugar will just boom, like 600. And then if you get them back, it'll normalize very quickly. But of course, the thing we most commonly think about is diabetes mellitus, which is where the blood sugar is chronically elevated because the body is not secreting a proper amount of insulin to manage the amount of sugar that the body is requiring to do its job. And then we have to treat them for diabetes, which we probably have a podcast on.
Yeah.
Surely.
And then if it's like the stress hyperglycemia, we'll check the urine. Typically, there's no glucose in the urine, and then we say, okay, you're not diabetic, it's stress.
Yes.
Or if sometimes everything, nothing's black white.
Nothing, like or. And then sometimes this, or.
Cats can technically like a little bit of glucose in the urine due to stress. So we would then do a couple other tests, be that follow up and recheck, or we can send out special panels that basically tell us the past 3 weeks of glucose levels.
Yeah. Yeah. And, sometimes I just wait for a minute and see how, that I had one cat that it took me, and because I think she was just like pre-diabetic. So it was probably 2 months before we were finally like, yes, this is diabetes. Because she would like look like it, and then she wouldn't, and then she would, and then she wouldn't. And then finally it was like, okay, this is for real. Yeah. And so now she's doing great.
And then you have one of our receptionist cats who's always comes in at a weirdly high glucose. And then you check the urine and you're like, okay, well, there's no diabetes, but it's like weirdly high. It's higher than what stress is supposed to go up to. She's just crazy.
Yep. Yeah. I mean, some of them will just, it's bananas in the 300s. Like, what are you doing?
She is. Yeah. And I was like, Sean, does your cat have diabetes? She's like, no, she does that. And I'm like, are we sure? And she's like, oh yeah.
Oh yeah.
I was like, well, I'm going to double check. And I was like, okay, you're not diabetic. I don't understand it.
Yep. Either she's just very sensitive on her glucose output. Yeah. Or I don't know.
That's it though.
Yeah, that's it. I feel really good about it. T4 we didn't touch on, but we have an episode on hypothyroidism, so reference that one. But those are all the things that we're really looking at on a routine panel, why we do them, and then, reference the other podcast episodes for what we do when we find problems with them, because that's literally 87 podcasts later.
How many we got?
I don't know. I'm going to count. I don't know. I'm guessing 60. I'm just guessing though. We were really good about every week for a better part of a year probably. And then after the tornado, it was just like, we've been so busy. Our schedules are so weird. We would always have emergencies come in and cut off the time. So
plus it's harder to find topic.
Yeah. So that's why we're always like, hey guys, if you have any requests.
Sometimes just get a party.
He's holding it like a pop star. He's got the stand in one hand. Oh, guys, this is why we should be doing FaceTimes. Don't try to screw it back in.
I ruined everything. Oh, we all agree.
He broke the chair when he sat down.
I hope you're safe drifting home.
Send us your podcast requests. Until next time, we'll probably talk about rat poisons.
And then
maybe the bird flu if we get brave.
Guys, yes.
If you're, you need to be paying attention.
To a little bit.
Yeah, okay. Okay, bye.